Good afternoon, everyone. I'm Dr. Nitesh Kalnide, intervention cardiologist working in Raheja Hospital. I've been in this field for the last 6.5 years. So today we'll be talking on a very important topic, that is management of cholesterol for the prevention of acute myocardial infarction. See, the main motto of today will be prevention is better than cure. Always prevention is better than cure. What can we do to such that the patient does not get a heart attack? So that's very important. Coming and treating is always good, but always it is better if we can prevent the incidence of heart attack. So let's see what is the cholesterol. So cholesterol is required for a normal function of our cell in the day-to-day activities. The most important in the brain, where they are required for the normal function of the cells of the brain and also help in transmission of electronic impulse from the brain to all other parts of the body. They are required for the normal function, metabolism of the cell. Important thing what we need to know is that the cholesterols can be metabolized in the body itself, and the extra what we take by the diet is always extra which creates a problem. So whenever there is excess of cholesterol, that can be LDL cholesterol, triglycerides, or the total cholesterol, whenever there is excess, they go and then deposit in the various arteries of the body. They can be get accumulated in the coronary arteries, in the arteries of the brain, arteries of the kidney, or sometimes in the lower limbs also, or sometimes the arteries which supply blood to the abdomen. Whenever there is mild, there's slowly over time the deposition in the artery goes on increasing, and the cholesterol content goes on increasing, and then it creates a blockage. Whenever the blockage is more, there's always a chance that this blockage might rupture, and this will lead to formation of a clot and complete obstruction of the arteries. So what happens in heart attack is there is cholesterol blocks which goes on increasing, and suddenly one fine day it ruptures. There is a clot formation in the artery, and then artery gets blocked 100%, and there is no blood flow to the heart, and this causes heart attack. So what important thing that we need to know, there are two types of cholesterol. One is good cholesterol, that is HDL cholesterol, and other one is LDL cholesterol, that is the bad cholesterol. So what is the function of the good cholesterol? HDL cholesterol is a good cholesterol. What it basically does is it picks up all the cholesterol plaques in the arteries and brings it back to the liver, from where it can be excreted. The function of LDL cholesterol is reverse. It takes the cholesterol from the liver and goes and deposits in the arteries. So that's why the cholesterol blockage increases, and that the main reason is LDL. So that's why LDL is called as bad cholesterol, HDL is called as good cholesterol. The most important now for us is how do we reduce this cholesterol, because any excess of this cholesterol is bad. How to reduce this is very important now. So we should know one thing is that adequate sleep, regular moderate exercise, and to avoid stress. This is one of the major things where you can reduce the cholesterol. Then the other thing is by diet. So our diet should include high fiber, and it should have low calories. Increase the consumption of fruits and vegetables, which will reduce your cholesterol level, and avoid all red meat, which will increase the bad cholesterol. Fish is known to increase the good cholesterol and reduce the bad cholesterol. And if you are taking any starchy food, it is advisable to take starchy foods that are slowly absorbed, like fruits. Among rice, basmati rice is slowly absorbed, and it is better compared to other forms of rice, beans, and preferable to take whole bread compared to white bread. And other most important that we should remember is the oil that we use for cooking. And many people ask me, like, which oil is good for the heart, which is bad. Every oil is bad for the heart, and hence the oil should be used at the least amount as much as possible. So if we see the oil, there are three types of oils. One is polyunsaturated fatty acids, and other one is monounsaturated fatty acids, and the last one is the saturated fatty acids. So we should increase in our diet, whenever we use oil, the saturated fatty acid should be avoided as much as possible, and polyunsaturated fatty acids and monounsaturated fatty acids can be used at the least amount of quantity. So now what are those oils? So the one that comes under polyunsaturated fatty acids are sunflower oil, soya oil, corn oil or fish oil. And then monounsaturated fatty acids are like olive oil, peanut oil, and almond oil. So oil should be used at the least quantity, and if we have to use it, Preferably select either sunflower, soya, corn oil, peanut or almond oil or olive oil. But whenever you use a oil, not to stick to one type of oil, because every oil has some form of bad qualities. So we should always keep changing our oil. Among the six which I have told, all this oil should be used at a minimum quantity, and everything should be circulated. Like suppose once we buy a sunflower oil, so next what we have to do is we have to buy corn oil, and then next time soya oil or olive oil, peanut oil. Keep regularly changing the oil, and avoid the use of dalda and vanaspati ghee and butter, and all this will increase your cholesterol level. And other important thing is the cooking. What is the method of cooking in which the cholesterol is less and the diet is less cholesterol and fatty acids? So important is the boiling and the steaming method. In this method, the oil used is very less, and without oil also it can be done in boiling and steaming. So this is good. Barbecue and grill method is also good because oil is not used in them, and while there is some nutrient loss when we heat it at a very high temperature, but also the fatty acids are also lost when we use the barbecue or the grill method. The very bad one is the frying method. Any frying method will require the utilization of oils. So this oil is very bad. So we should reduce the fry items. Anything fry, fish, even as I said that fish is good, but when we fry the fish, so it comes along with that oil. So that oil is bad. So fried fish should be avoided. Any fry items as much as possible, even though it's a veg, should be avoided as much as possible, because they require the oil, and the oil gets absorbed in the food while cooking, and then it is absorbed in our GI tract, and then it gets deposited, cholesterol gets deposited in the artery. So important is to avoid as much as possible the fry items. The other things with which we can reduce cholesterol is by medication. Various statins are available which your doctor will prescribe you for the high cholesterol, other things. And other important thing is which are the other foods that can reduce the cholesterol. They are the peanuts can reduce, almonds can reduce, all this nuts and all walnuts, they can also reduce the cholesterol. They also have to be included in our diet to reduce the cholesterol. So in short, if we see the diet, use oil as less as possible. Cooking method, the best one is steaming and the boiling method. And diet, increase dietary fiber in your diet, reduce the level of calories that you eat, and eat nuts like walnut, almond, peanut, which will reduce the cholesterol level. The other major question which everyone asks is who all should get tested. Regular testing of the cholesterol level is required for this category of people. They are like age, whenever the person's age is more than 45 years of age, they should get that cholesterol regularly checked. Other thing is if the patient is having diabetes or hypertension, they have increased chances of having the increased cholesterol. So this has to be checked regularly. And any young people also less than 45 who has a family history of early heart attack or a stroke in their family, or that many other uncles, aunts, parents, grandparents have got any stroke or heart attack at an early age, or they have increased incidence in the family, then those people should get their cholesterol checked regularly. And anyone with previous heart attack or stroke, they should get their cholesterol checked regularly and keep it under control. Various levels are there of what cholesterol should be checked. That is for the normal people without any comorbidities, it should be less than 116. And the other end is people who had got an attack or any form of coronary artery diseases. For them, the level should be much lower. It should be less than 56. So important thing is what we need to realize is the lower level of cholesterol. The lowest is always the better. Keep it as low as possible. And it should be remembered that this has to be maintained for your entire life. The lower cholesterol, always better. The other motto that we should always remember is prevention is better than cure. It is always better to prevent an attack with the controlling of your cholesterol than to go to a hospital with heart attack and get all angioplasty and bypass done. If we reduce the cholesterol, we can definitely reduce the incidence of heart attacks to the patient. An important thing in this COVID era, I wanted to make people realize is that the hospitals, they are always there to treat for the heart attacks, but also remember that hospitals is always there, and we are always there to reduce your cholesterol and other risk factors which can reduce the incidence of the heart attack. We are there for the treatment of heart attack, and we are also there to prevent the heart attack in this patient. So it is always better you get your cholesterol checked regularly and live a very healthy life and lifestyle modification, healthy life, and control your diet and meet your cardiologist regularly, even in during this COVID era, will always be better for you. Thank you.